All right, let's dive right in. Today, we're going to talk about some really smart tools that doctors use to turn incredibly complex calculations into life-saving decisions. We're talking about nomograms. These are essential guides for customizing drug doses to make sure they're not just effective, but safe. So think about this for a second. It's a really high-stakes question that every single clinician faces every single day. When you're prescribing powerful drugs, the line between healing and harming can be razor thin. Sometimes it all comes down to one single calculation. So how do they get it right every time? Well, the answer isn't what you might think. It's not about doing more complicated math. It's actually a tool that is brilliantly simple in its design, but incredibly powerful in how it's used. A tool that brings some much-needed clarity to all that clinical chaos. To really get why this tool is such a game changer, we first have to understand the problem it's built to solve. And that is the high-stakes, high-pressure calculation of drug dosing. You see, here's the core challenge. We're not all the same. A one-size-fits-all approach to medicine just doesn't work. In fact, it can be really dangerous. Your age, your weight, and especially how well your kidneys are functioning can totally change how your body handles a drug. And that brings us to the solution. So let's meet the hero of our story, a clinician's secret weapon for navigating all this complexity. It's called a nomogram. The easiest way to think about it is like a clinical cheat sheet. It takes these super complex pharmacokinetic equations, the math that describes how a drug moves through your body, and it turns them into a simple, easy-to-read chart. These things are built using data from thousands and thousands of patients, which gives doctors a really solid starting point. So, why are they so important? Well, for one, they slash the risk of human error. They give doctors quick recommendations right when they need them. And most importantly, they make things so much safer for the patient. They're especially useful in really busy hospitals or for patients who aren't average, like the elderly, simplifying that critical first step of picking a dose. And just look at the difference here. It is night and day. On one side, you've got the old way, wrestling with confusing equations, a huge risk of getting it wrong, and trying to make tough decisions under pressure. And on the other side, a simple, clear diagram, way more safety, and fast, reliable recommendations. It's a total game changer. Now, for these tools to work, they need data. And one of the most important pieces of data is how well a patient's kidneys are working. This is often measured by looking at their serum creatinine level. Creatinine is basically just a waste product, and healthy kidneys filter it right out. So here's the key. If your creatinine level is high, it's a big red flag that your kidneys aren't clearing drugs like they should. A nomogram uses that info to suggest a lower, safer dose. Let me give you a perfect example of this in action. A class of powerful antibiotics called aminoglycosides, like Tobramycin. These drugs are almost entirely flushed out by the kidneys. So if a patient's kidneys aren't working at 100%, that drug can build up to toxic levels fast. This is a classic case where a nomogram isn't just helpful, it's absolutely critical. Okay, but what if a doctor doesn't have all that specific patient data right away? What do they do then? Well, they start with what's called an empirical regimen. It's basically an educated guess, a starting dose based on their own experience and what works for the average person. But it's just that, a starting point. Because that starting point, it's just the beginning. The real goal, the ultimate goal, is to land on a dose that's perfectly tailored to that one individual. And that happens through a really clear three-step process. You see, tailoring a dose isn't a one-and-done thing. It's more like a feedback loop, a conversation with the patient's body. It starts with an educated guess, but then it uses real data to zero in on the perfect dose. First, you design that initial regimen, often with a nomogram. Second, you actually measure how the patient's body is handling the drug. And third, you use that info to fine-tune the dose until it's just right. Let's break that down. Okay, step one. This is where it all starts. The clinician picks that initial dose. They might just go with the manufacturer's general guidelines or, and this is much better, they'll use a nomogram to get a more personalized dose right from the get-go by plugging in the patient's specific details. Now for step two. This is where we move from prediction to reality. After that first dose is given, blood samples are taken. And this is so important because we're moving beyond averages. We're finding out how this specific patient's body is actually processing the medicine. No more guessing. And And finally, step 3 is all about fine-tuning. Based on what those blood tests show, the doctor adjusts the dose or maybe the time between doses. They'll keep tweaking and monitoring until they hit that sweet spot, that perfect concentration where the drug is doing its job effectively without causing harm. Okay, so let's zoom out for a second and look at the big picture, see how all these pieces really fit together. This really lays it all out, doesn't it? You can see how each part connects. The nomogram is that brilliant starting tool that simplifies everything and cuts down on errors. The patient's own body, their physiologic parameters, gives us the crucial data we need for adjustments. And that 3-step process, that's the roadmap to achieving the ultimate goal, a therapy that's perfectly safe and effective for that individual. So what's the bottom line here? What should you really take away from all this? First, nomograms are absolutely vital for drugs where the line between helpful and harmful is super thin. Second, they're essential for tailoring doses for anyone who doesn't fit that average mold. And finally, the whole point of this entire process is to move towards individualized dosing to make medicine safer for everyone. And that leaves us with one last big thought. As medicine becomes more and more personalized and our tools get smarter and more powerful, the big question is this: how do we strike the right balance between these incredible tools, like nomograms, and the irreplaceable wisdom and judgment of an experienced doctor? That's a question that's really at the heart of the future of medicine.